Can the hormone progesterone promote breast cancer? Can the progestins in oral contraceptives and hormone replacement therapy promote breast cancer? Overall, the answer is no. Both progesterone and the progestins in oral contraceptives do not promote breast cancer. In fact, progesterone inhibits the growth of cancer cells. The situation is a little more complicated than this, however, although that is a fair overall summary. First of all, progesterone, the hormone, can be metabolized in a couple of other steroids, and some of which have differing effects on breast cancer cells. So it is possible for progesterone to be broken down into something which might stimulate a cancer cell. Although progesterone does not cause cancer cell growth, some of the progestins used in oral contraceptives do not exactly mimic progesterone. And so therefore, since they are synthetic, they may have a slightly different effect on breast cells compared to the natural hormone progesterone. Also, there may be some more complex interactions. For example, oral contraceptives may pose a slight risk to women, but only women who have a certain mutation of a specific gene, such as, say, one of the BRCA genes. And so therefore, overall, progesterone does not increase cancer risk, although the full explanation is slightly more complicated than this general statement. Androgen hormones, such as testosterone and other androgens, decrease the risk of breast cancer. They inhibit the development of breast cancer cells. Once again, this is a good summary statement, but a full explanation is slightly more complicated than this. Cancer cells are, by definition, abnormal cells, and while normal cells of the breast are inhibited by hormones such as androgens, there have been cases where androgens have promoted the growth and proliferation of cancer cells, which in a specific patient had an abnormal reaction to this hormone. Estrogen is not the only hormone which can promote cell division in the breast and encourage breast cancers in high levels. Prolactin also increases cell division and is produced within the breast in addition to other tissues such as the uterus. Norregulin is a growth factor which can both initiate and cause the progression of breast cancers. This hormone interacts with the epidermal growth factor family of receptors, which are classified as proto-oncogenes involved in a number of cancers, including breast cancers. Elevated expression of these receptors are found in perhaps as many as a third of breast cancers. The hormone leptin, made from adipose cells, increases the risk of breast cancer. Weight gain and the increased frequency of obesity are major health concerns in our country. Now, these concerns affect many aspects of physiology, but they also increase the risk of breast cancer. Adipose tissue can not only make its own estrogen, it makes the hormone leptin, which increases the risk of breast cancers and other cancers. Adipose cells can also make a series of inflammatory factors, which will increase the risk of breast cancer. So weight gain and obesity are risk factors for breast cancer. The condition diabetes and its precursor, known as hyperinsulinemia, are characterized by elevated levels of insulin, at least this is found in diabetes type 2, and also one of insulin's molecular partners, insulin-like growth factor 1, or IGF-1. Both of these are capable of promoting the division of cells within the breast, and high levels of these are associated with increased risk of cancer. Breast cancer rates are 7 times greater in women whose IGF-1 levels fall in the upper third of the population. Thus, weight gain and diabetes are not only negative in their own right, but also increase the risk of other disorders such as breast cancer.